Evening, everyone. So my name is Emily Armstrong. I'm the Regional Technical Lead for our companion animal portfolio here at DECRA. And as someone with an interest in dermatology, it's my absolute pleasure to share my evening with lots of like-minded colleagues and to welcome you all to this webinar. So just a little piece of housekeeping before we start. Tonight's event's going to be split into sort of two parts. So we have the main lecture from, oh, I don't know which side of me I'm going to be on my screen, but we have the main lecture from Dr. Bourgeois, and then we're going to open the floor to a live Q&A after that. But don't feel like you need to save all your questions up for the end. If anything pops into your mind now or during the presentation, you should at the side of your screen, whichever side it is on, have a like a panel of which there is a questions function in there. So pop your questions in there now during the presentation at the end, and we'll collate all of those to pose to Dr. Bourgeois a little later on. I know you're really looking forward to everything that people are going to throw at you, aren't you, Dr. Bourgeois? So
I love getting questions. I'm excited.
good. And for those, it's probably not needed, but for those of you who aren't familiar, I just want to do a brief introduction of our speaker this evening. So Dr. Ashley Bourgeois is truly a certified derm nerd, I think we can say, can't we? She graduated from the University of Missouri in 2010 and then became a diplomat of the American College of Veterinary Dermatology in 2014. We then moved to Portland, Oregon in 2016, and where you've continued to work in your animal dermatology clinic, where you practice today. Strong interest in autoimmune skin diseases, allergy, and then of particular relevance for us this evening, cytology and otology. In a leisure, you and your husband stay very busy with your daughter and your son, and obviously your pit bull boxer mix. So not only are you an interested derm vet, you're also, like me, a derm dog mum too. So we can put things into practice at home. But the main reason why we have Dr. Bourgeois with us this evening is that she's truly passionate about educating veterinarians in dermatology. And if you're not already familiar with or following Dr. Bourgeois on the social media or listening to her podcast, I can personally recommend it as someone who loves dermatology. There's some really great content there. So just search for the Derm Vet and you can continue getting your derm fix when you want to. So with that, we're going to start tonight's webinar. Like I say, pop your questions in now, throughout, and hopefully we can all enjoy. Thank you.
Well, thank you so much for having me to talk about ear disease. Obviously, as a dermatologist, I treat a lot of otitis externa, otitis media. My name is Ashley Bourgeois. I am a board certified veterinary dermatologist in the United States, practicing with Animal Dermatology Clinic in Portland, Oregon. And I do see a lot of ear disease. And there are a lot of products and innovations that we have had surrounding otitis externa. So I really want to spend time talking and teaching about the different options that we have, how we need to be cautious about how we're doing diagnostics in otitis, and hopefully leave you with some exciting things that you can try in your practice as you move forward in treating ear disease. So I, of course, want to thank DECRA for putting together really good continuing education and asking me to speak to you today. So I do have a passion project called the Derm Vet. It's really out of respect for general practitioners, how much that you guys have to manage in a general practice, whereas a specialist, I can punt a lot of things and say, that's not really me. But you guys can't always do that. You know, whether you are a veterinarian, a technician, it's really important that we put as much information out there for you, because conferences, there's a lot of options that you have. So the Derm Vet, I do a lot on social media, especially Instagram, some on Facebook, where I just put up cases, I put up information, little clinical pearls that you can use really quickly. And then I do also have a podcast that releases weekly. And that has been a really exciting journey the last almost 6 years. And more recently, I have turned that podcast also into a YouTube channel where I can show you images and videos of these cases as I am recording the podcast. So if that is something interesting for you, I hope you'll consider checking it out. So, what are we going to earmark for our discussion today? So, we're just going to start out with some basics, which you're all probably very familiar with, and we're going to break down otitis itself and working it up and how we get to the point of knowing what we're going to use as options to treat. Then we're going to talk about topical therapy and why topical therapy is so important and essential, but we also really have to be considering the ingredients that we're putting into these ears. Then the rise of the resistance. So, what type of resistance are we seeing in our world today? And I will tell you, as a dermatologist, we're seeing a lot of bacterial resistance. So, we have to be very careful, cautious of what we're putting in the ears, putting on the skin, because we are seeing year after year that resistance is getting worse and worse with bacteria. Then we're going to talk about fungal foes, so yeast and how it can still be a really big problem for our cases. We have to be thoughtful of how to treat them. And then really ending with innovative solutions in ear therapies. What are the things that are out, that are newer, that maybe can help us accomplish some of these goals of being thoughtful of bacterial resistance, but also still being effective against certain organisms like Malassezia. So let's jump into breaking down otitis. Again, something you're all probably very familiar with. We'll do a brief overview of what we expect when we're working up an ear case. So I just want to start out looking at the UK. I have data obviously from the US where I practice, but I really dived into what's available in the United Kingdom. So the prevalence of otitis, this is a paper that was published a couple of years ago. See, periodontal disease obviously is something that you guys see a lot of, which makes sense. But look what number 2 is, otitis externa. You guys are dealing with lots of ear disease just like I am in your practice. Then, of course, you go into the other things like obesity, overgrown nails, anal sac impaction, diarrhea, vomiting, lameness, osteoarthritis, and aggression. But otitis is something that you are commonly seeing probably day in and day out in your general practice, which is why it's important to know what options are available. I love this study in this picture. And this just goes to show how the microbiome for these cases, these allergic cases, because that's predominantly what you're seeing otitis externa for, especially in dogs, though of course there's other reasons like ear masses that can happen. But we know that the microbiome, the normal population of bacteria and fungus that live on the skin, if you are clinically affected, an allergic dog with a disorder, is different than what we see in healthy animals. We have less diversity. We know in the skin and the ears, we see a predilection, a abundance of things like staph pseudo intermedius. For fungus, we see an abundance of Malassezia pachydermatous. So we usually should see these organisms live in harmony, but within our allergic patients, which we see a lot of in our clinic, they just don't have a normal microbiome. So when they flare, they can more easily develop these infections, which is really important to explain to owners. Another study I just love that's been out for a little bit. Even normal ears in atopic dogs are not normal. Why is this important? Maintenance, really looking into the ears, really educating owners what to watch for. This is a study that looked at ear canal microbiota of healthy and atopic dogs, but these atopic dogs did not have clinical signs of otitis. They seemed like their ears were pretty normal, but based on their history and their workup, they had atopic dermatitis. So they took ear swabs and looked at global bacterial DNA extraction. And what they found is very similar to the paper and graph I just showed you. The diversity was not what we expect in healthy dogs. So dysbiosis was noted in atopic dogs. And again, these are ones without clinical signs of otitis externa. You look in the ears, they look pretty normal. They had an abundance of staph species. So this just goes to show that maintenance, showing owners what to watch for is important, because even when atopic dogs' ears look normal, they're not necessarily normal. So why does otitis matter? Right? It's really easy. You guys are dealing with lots of stuff, lots of, life-threatening stuff. Why do we care so much about otitis cases besides the fact that you see them a lot? It's uncomfortable. If you've ever had your pet or if you have a child who deals with ear infections, it's really painful. It's uncomfortable. It can affect the relationship with the owner. I'm sure you're similar to me that your owners will say they struggle to do things with the ears. These dogs learn to be really head shy and kind of get away from them when they see the ear flush bottle, the ear medication bottles. Because if you think about a chronic disease like atopic dermatitis, and then you put on, well, you put stuff in my ear when they're ouchy, dogs are smart and they learn very quickly to shy away from that. It requires a lot of frequent handling, right? Ear flushes, topical medications, maybe systemic medications, maintenance protocols. So it's not something that most of these dogs you can just treat once and they're done forever, right? We probably need to readdress when seasonal flares happen. We need to have them on maintenance flushing protocols. So it can be really daunting. It's that chronic recurring issue. Think about the things you see: bad odors, pain, pruritus, behavior change. They're really aggressive because they're painful from their ear, head tilt. And then ongoing management. Again, it's expensive to have a dog with recurrent ear infections. Physical ability. Can you actually get your dog? Can you actually physically flush the dog? Patient compliance. They hate it. They don't want to have the owner mess with their ears at home. What are the clinical signs we see of otitis? Again, you guys are probably expert, but differentiating externa from media. From externa: head shaking, oral pruritus, just really scratching at that ear. Sometimes you can see erythema from the outside, bad odor, discharge is actually coming from the ear. If we get to the point that externa becomes media, you could see a head tilt, vestibular disease. You could hear hearing loss, which we see with the chronic patients. And you can even get pain when opening the mouth because the bulla sits right here. So when they open their mouth, that could be really painful. And then diagnostic approach to otitis. So they have otitis, how do we figure out why it's there? So there's acute versus chronic and or recurrent. So, it's a unilateral, painful, all of a sudden ear in a young lab who runs around outside a lot. I probably have a different differential for that versus a basset hound who has struggled with recurrent ear infections their whole life. Are there other signs that happen? So, yes, they come in for an ear infection, but I'm always asking, do they lick into their paws? Do they scratch other places? Do they have a history of being itchy? And then during your physical exam, again, don't just look in the ear, look at other places that can give you a hint that something's going on. So, where the inflammation and locations happening on your otoscopy exam, what type? Is it pus? Is it brown? Is it dry? Evaluate other locations. So we see this paw in a dog who has recurrent ear infections. I'm probably thinking allergies are a possibility. And then what's really important during your ear exam is to palpate that tissue, palpate that ear canal. If it's really calcified and hard as a rock, you cannot reverse that medically. So they probably should see surgery. But it can look really swollen and stenotic and bad. If you palpate and it's all flexible and the cartilage is not calcified, you absolutely can medically manage that case. So it's really important to palpate the ear canal as part of your process. So these are all just examples of ears that come in looking really uncomfortable. They all have different types of infections. They have different reasons the underlying infection is happening, right? You can flip up the ear and see that scaly, crusting erythema we see in that left picture, some erythema, a little bit of thickening, brown debris in the middle picture. And then clearly the one on the right looks bad, right? You can't even get a scope down that ear. I don't even really try when they look this bad because I'm probably not going to get very far. But all of these were able to be medically managed. Even that one on the right that looks pretty bad, it was not calcified, and we were able to completely open up that ear canal. And then again, when you look for ear canal disease, you want to look for why is it there. So you have this ear, it obviously looks infected and painful, discharge swelling, but do you look at the rest of the physical exam and see this paw? Maybe we have underlying atopic dermatitis or food allergies causing that. Do we have something like this? You can see little biopsy areas. So clearly we biopsied this dog, but this is a dog I diagnosed with pemphigus foliaceus, but had a really, really bad otitis associated with that disease. So otitis doesn't always mean allergies. Other things can cause it. Or do you look in and you see a mass that's staring back at you? So the history of this is really important. Making sure we understand why the otitis is there is extremely important. And then, of course, you're going to swab these ears. We need to do cytology because we need to know why it's happening, what type of infection is there. So we're usually using swab technique just like you guys are. There are limitations. It usually gets the vertical canal and maybe to the junction of the horizontal and vertical canal. So if you have deep horizontal canal disease or an otitis media, then you're not going to probably get a lot of information with this. But for day in, day out, normal practice, this is a great way to sample, rotate or scoop to collect that material, and then roll it onto a slide. And then as we end talking about diagnostics, just know which ear you're putting on the slide. It sounds simple, but we're all busy in the clinic. So it is important to sample both ears if they have two ear canals, even if they say they're just bothering one. Some people like to write an R and an L. Some people put right by white, so they put the sample by the frosted section. Some people put the left side by that section because they call it left by label. Whatever works for you, just be consistent and make sure your staff knows where you want your samples so that we know what ear we are looking at. And then what are the common offenders? So obviously we are usually dealing with yeast, cocci, or rods, or some mixture of these. So it is really important. I've been fooled time in and time out where it looks like, man, this is definitely going to be a yeast infection. I sample and then I find out that it's actually a bunch of cocci. So it is really important to recognize exactly what you're seeing on cytology so that we can get them on the right treatment plan. So now let's go into targeted topical therapy. So with our topical therapy, we want to realize it is important to focus on topical therapy when we're able to. We're going to talk about why that is important, but also what you are using. You know, these products are not all created equal. They have different ingredients in them, different strengths of things like steroids in them. So you really want to get familiar with these topical products because it is not a one size fits all in these patients. So, why is topical therapy the treatment of choice? Why shouldn't we just rely on things like antibiotics? Well, we get a higher concentration of medication in the ear canal. So, instead of expecting that pet to take a pill, break it down in their stomach, get it to their bloodstream, and then get up to the cartilage of the ear canal, you're putting the medication right where the problem is. So, you're getting a much higher concentration of medication. It puts it directly in the area, and then it limits our systemic absorption. Again, we want to be cautious about just overusing systemic antimicrobials when we potentially don't really need them, especially in otitis externa cases. And then when we talk about things like flushing, why it's really important to flush within the clinic or have owners do it at home, because one, we might get rid of obstruction so we can see things like a foreign body or a mass. Two, if there's a bunch of excessive ceruminous debris, that is uncomfortable for the ear, but it also lets your topical medication penetrate the epithelium better. You know, if we have things like biofilm or a bunch of debris in the ear, you can't expect that putting it in the eardrop in the ear is actually going to get to the skin of the ear because it's just going to get caught up in all that junk. So it's really important that we actually get rid of things so that we can actually have that medication be effective. I love showing this when it really talks about the importance of topical therapy. The concentration that we put in that ear canal can be up to 1,000 times superior to minimum inhibitory concentration. And traditionally, we have lived by MIC, right? When we do cultures for the skin, things of that nature. But this has been for a while a concern that MIC, these breakpoints, may not be exactly at the right place, or we need more than that. So there's actually something that in some of these medications we're looking at called mutant prevention concentrations. There is a concern if you look at this graph that if you're in this mutant selection window, which is MSW, you're above MIC, but you're not quite to the point of 2 mutation steps away, that you could breed mutants in the long run, which is kind of scary. So the benefit of topical therapy is you're getting such a high concentration in the ear that you're hopefully getting to that mutant prevention concentration. And we are limiting the concern of the selection window, which could lead to more resistant bugs in our future, which we already see enough of, too many of. Then think about our categories of topical therapy. So as we talk about topical therapy, there's of course cleaners and flushes, which are super important. Get that stuff out of the ear, recognizing what you're putting as far as a flush in the ear, because ultimately they also have different ingredients and purposes. There's the antibacterial property to something. Does it have an antibiotic in it? If it does, what is that antibiotic? What are we using it for? Antifungal, again, not all antifungals are created equal. We want to think about what is truly in the product. And then anti-inflammatory, sometimes that's helping me guide my selection, right? I need to make sure there's a steroid in that product to reduce some of that local inflammation because these patients are so uncomfortable. We find that if we can control inflammation by using a product that has a steroid in it, that we can have more success because that inflammation is happening from infection, but often it's happening from the primary reason too, like an underlying allergy. So, how do we choose the right antimicrobial therapy? So, two things we want to base it on: what we see in cytology, bacteria, yeast, inflammatory cells. If we see bacteria, what type of bacteria? Are we seeing bacteria at all, or is it just yeast? Then, do we really need an antibiotic in that ear? And then otoscopic evaluation. If there are a lot of ulcerations, if there's stenosis, if there's a bunch of bad discharge like this ear on the right, then we probably want to be thinking about, okay, what flush are we using? Do we need to recommend a video otoscopy for a deep ear flush? Do we need to change the flushing protocol they're on? Because that debris being in the ear itself can be a big problem for that pet. Why does our topical therapy fail? So, when we use topical therapy, there can be various reasons why it's not effective. So, one, we just don't have the right antimicrobial, right? We didn't actually think about the ingredient going in the ear. Maybe it's not a bacteria at all. We just chose incorrectly. And we can get resistant bacteria where that happens, even though we feel like we should have made the right choice. Advanced perpetuating factors. So there is a ton of swelling in that ear. They can't even get the topical product down there. Perpetuating factors are all those kind of secondary issues that happen from the infection. So you get a really bad infection in the ear, and then your ear gets really inflamed. It starts collecting edema. It gets stenotic. And then obviously can get really bad, like calcification. If you get really bad perpetuating factors, that alone can make it very difficult to treat these ears. You're not controlling that primary disease process. So maybe what you're doing for the ears is fine, but you're just not controlling the underlying disease. The underlying allergies, we're not, maybe we need to do a food trial, maybe we need a different allergy medication, maybe we're just not controlling that primary disease. Inadequate concentration, you're just not getting enough stuff when you put it in the ear canal. And then poor compliance, which is a huge one. I have a dog who deals with ear infections. I'm a veterinary dermatologist, and it's hard for me to keep up with it. So, our owners not being able to effectively get stuff into the ear canal, having really busy lives, and just forgetting, that can definitely lead to topical therapy failing. So, educating, making sure we know the products that are out there, asking owners, are you able to do this? Can you put something into the ear canal? Can you flush the pet's ears? All of those become extremely important when we actually talk about it being successful. All right, so now let's go to the scary part, and that's how resistant we're seeing a lot of these bacteria. We are seeing year after year worse and worse resistant. And listen, I live in a country where we're one of the worst with resistance in the United States. So we have to be really thoughtful of not only stopping progression, but just trying to improve the resistance we're already seeing within our clinics. I just want to take a step back and recognize that it's so bad that we have this terminology that maybe a lot of you are familiar with, but maybe some of this you're not. So, of course, we're really familiar with methicillin resistant staph, which inherently means resistant to all beta lactam antibiotics. It doesn't matter what your culture says. If it's methicillin or oxacillin resistant, then you do not want to use a beta lactam just based on that MECA gene and how it works. Then you'll hear people say multi-drug resistance. And this means a co-resistance to two additional antimicrobial classes. We see this a lot with our gram-negative organisms. We certainly can see it with staph organisms as well. Did you know there's even XTR, that it is non-susceptible to all but two or fewer antimicrobial classes? That means that bacteria literally has one or two drug options, and that's it. And I will tell you, I deal with situations where there's nothing, and we're having to do all sorts of crazy things on the skin and the ears to get that under control. So you be really, really careful and just realize that we are getting to the point of so much resistance in our world that we're getting all of these scary terms to describe it. And so looking at some of the papers out there, and a lot of this is derived around pyoderma, but it would certainly be implicated in just overall bacteria warning. Methicillin-resistant staph, looking at this paper from 2017, a global problem creating a serious challenge to successful treatment of staphylococcal infections. So yes, we often think of the skin and pyoderma, but this absolutely can still hold true within otitis externa as well. So there are guidelines put in place to provide recommendations for the diagnosis, prevention, and treatment. And a lot of it goes back to your diagnostics, your cytology, controlling underlying disease, being thoughtful of what you're actually putting in the body of these patients. So, how can bacteria be resistant? Lots of ways, unfortunately. So, they can alter their drug targets, they can create inactivating enzymes. We think of things like Pseudomonas, but it's not just Pseudomonas that creates biofilm. So, we think often Pseudomonas, biofilm, slime layer, purulent debris. I'm going to show you a paper that actually looked at how it can be hard to tell Pseudomonas from Malassezia even just from the naked eye. Obviously, cytology helps. But other things, there's studies showing Malassezia can create biofilm. There's studies showing staph can create biofilm. And biofilm is basically a slime layer that creates above these organisms. So getting a good in-clinic flush before we do these treatments can be really helpful. They can have efflux pumps that get created, and they can have genetic exchange. They can trade secret information of how to be resistant to the antimicrobials that you're using. So bacteria are quite smart. We often don't give them enough credit for it, but they are very smart. So when we blindly treat these cases or we don't educate ourselves on the better options available, if we don't talk to the owner, are you able to do this at home? If not, we have in clinic medications that can be used where we can control that aspect, right? We know they got it because it was done by us in the clinic, that we are trained to do these topical treatments appropriately. We have to ask owners how to do this the best way, how they're able to be successful, and then use our education to make sure we use the products in the means necessary to actually get this done. Because we do see a lot of bacterial resistance in different ways that they can do it. So, what is the clinical impact of resistance? Like, why is it such a big deal? I mean, hopefully, we're not really questioning that, but let's look at it. Treatment failure. So, how frustrating for the client in the discomfort that pet has to experience if the treatment doesn't work. It's very frustrating for clients. And for me as a clinician, right? I'm not super happy when I have a patient come in, recheck, and they tell me it's not working and they're doing everything right. Like I get frustrated by that. So I get frustrated if it's not working, the client gets frustrated if it's not working, and it's uncomfortable for the pet. The cost, right, for my poor client. We have to keep trying therapies because of the resistant bacteria. We have to repeat diagnostic testing to see what's going on. We have to have another veterinary visit charge that's in there. And then, of course, the perpetuating factors that can develop. So, edema happens, stenosis happens, pain, and unfortunately, the end stage calcification that I can no longer medically reverse, and we have to send them to surgery. So, it is a big deal if we create more and more of these resistant bacteria that are not able to effectively be treated with the options that we do have. And other consequences, right? So oral hematomas, if they keep dealing with that ear infection, they keep shaking their head, they keep being uncomfortable, we can get oral hematomas. I just had to do an oral hematoma surgery on a patient, and it's a cost, it's a frustration, it's a procedure that pet has to go through, and they can be really tough. And then, of course, you get the really bad ones, like this one being shaved for a Tika bow surgery. So having to go through a total ear canal ablation and bully osteotomy because we can no longer save that ear. It's calcified and it's uncomfortable. It's a cost for the owner. It's a frustration for the owner. But they can do very well if you get to that point. But of course, we don't want to get to that point. So how do we prevent it? And then we look at all these different organizations, right? So where I'm at, AVMA has a lot of guidelines on this, but they're all very similar throughout these different organizations. So between all these organizations within Europe and the United States, right, we want to have core principles like committing to antimicrobial stewardship. I know you guys hear about this, right? Being thoughtful, judicious use of antibiotics is often thrown around as a term, but what does that really mean? We're thoughtful of what we're putting in these ears. We advocate for a system of care to prevent common diseases so we control that underlying allergy, even though we may not want to have to do an allergy workup, we really should so we can prevent these infections from happening. select and use antimicrobial drugs judiciously. So, not just throwing antibiotics into something, but actually making sure that's the appropriate thing for that pet, doing cytology, looking at the pet, evaluating it. Look at antimicrobial drug use practices. We should have a few different options for ear topical therapies on our shelf because not every bacterial infection will be created and treated the same. So we want to make sure we're thoughtful of that. And then educating and building expertise, doing awesome CEs, hopefully like the one you're getting today, and just learning the new products that are out there, the new patterns we're seeing, being really committed to the innovation and progression of our industry. So now we've talked about bacteria. Yes, scary. We don't want to create resistance. Now let's talk about the fungal foes. So sometimes I think we see Malassezia and it's really easy to be like, it's just yeast, it's just yeast. But yeast can be a really big problem for our patients. So we want to make sure that we are effectively treating these cases. So let's just back up. So Malassezia pachydermatous, normal skin flora of warm-blooded vertebrates, 18 species currently that we know of, some very host specific. So in dogs and cats, we tend to see Malassezia pachydermatous. As people, we can have other forms more common like Malassezia globosa. It's a commensal organism. It lives there in harmony. It's meant to be there. It's not found in the environment, so they don't catch Malassezia. It's their own entity that can overproliferate because you have something like a primary disease that is there. So it's a lipid-dependent fungi. It can use fatty acids and oils in skin as a food source. And then the balance is disrupted, like we saw from those previous papers, in allergic disease and chronic ear disease. So when they're dealing with a primary disorder, we can ultimately see that we get yeast overgrowth, yeast dermatitis on the skin and in the ear canals. So Malassezia otitis, proliferation of yeast in the ear, secondary and underlying cause. We most often see it from atopic dermatitis, but of course, all those things we described before can cause Malassezia in a dog ear. Food allergy absolutely can cause Malassezia otitis, but we do see it a lot from atopic dermatitis as well. It triggers inflammation. It can cause hyperplasia in the ear and discharge. It can be very itchy, very uncomfortable, very painful for our patients when they're dealing with it. It can also incite a hypersensitivity reaction. So we know that excess antigens can activate that immune system. It can cause intense pruritus and proliferative changes. I have seen very significant Malassezia otitis cases where they do get the swelling in the ear. They are extremely uncomfortable. You want to be looking in the ear canal itself, but you also want to be looking for things like pinal infections like we see here. Getting a direct impression smear, getting a swab of that can be super important because pinal infections can often coincide when you're with an otitis externa that you're dealing with and can be very itchy for the patient. Clinical signs of yeast otitis. Of course, these are not a catch-all, right? You can have other ear infections cause these symptoms as well. But typically we get an odor, they get a brown waxy discharge, it can either be really slimy and moist. We're going to look at some pictures of that, or it can be that dry, flaky brown material you see. They tend to be really erythematous, so red, irritated in the canal or on the pinna itself. You get that pinal scaling or lichenification we just saw in that previous slide, and very pruritic. So they're uncomfortable, they're shaking their head, they're scratching with their back paw. They're just really not having a good quality of life when they're dealing with a significant Malassezia otitis. So I actually recently was looking through the literature and saw this very recent publication. And this is about suppurative Malassezia otitis. And I found this really interesting and just wanted to bring it to the forefront. So suppurative Malassezia otitis is being reported as a severe presentation of Malassezia otitis, clinically mimicking suppurative bacterial otitis. So there's your cases seen at the University of Tennessee that actually were assumed to be Pseudomonas otitis just based on the appearance, and other diagnostics hadn't been done. So they saw this particularly overrepresented in young male poodles, but clearly you could have any breed that's affected. Of the 9 cases they had, 6 of the 9 of them were poodles or poodle mixes. But essentially what they saw, if you look at these ears, is it kind of looks like a Pseudomonas. It doesn't have that white purulent debris you think of some Pseudomonas, but it really could look like a Pseudomonas with how moist it is and kind of that biofilm distribution. In fact, only the left one's from the paper. The right one is one of my cases I had of Pseudomonas otitis. So this is how tricky this can be, and this is why diagnostics and making sure you're putting products in the ear that are actually treating what you're meant to be treating is so important. So if I just looked at these clinically, I could not for sure tell you which one's malassezia and which one's Pseudomonas. I could have told you both of these are malassezia, and I would tell you that's possible. You could tell me these are both Pseudomonas, and I would say that is possible. You could tell me both of these cases were both malassezia and Pseudomonas. Pseudomonas sometimes like to have a malassezia friend, and I would say it is possible. So that is why it's really important for us to do diagnostics, but also recognize some of these products and the different ingredients they have, we want to treat appropriately. We don't want to throw a bunch of medication that's meant to go for Pseudomonas in these malassezia ears. So now let's go through some of the options that are out there. We're going to focus mostly on the ingredients, recognizing that some countries have different products. So when we look at traditionally the topical fungal, so we're really focusing on malassezia here, flushes and treatments that are available. One is to mess with the pH of the ear. So you don't have to necessarily just put an azole in the ear for your flush. You can actually reduce the pH, and that on its own can be anti-yeast. So you'll see a lot of flushes that have acetic acid in it, boric acid, traditionally Burroughs solution, vinegar flushes, washes have been created. And it is with that purpose to decrease the pH of the ear. Malassezia doesn't want to live in that type of environment, so that can help get rid of it. Then you have certain topicals and flushes that have azoles in them. So miconazole, clotrimazole, thiabendazole, ketoconazole, posaconazole. All the azoles are a bit different in their potency and how they work, but the end game is very similar in their mechanism of action. And then you have terbinafine. Terbinafine is not an azole, but it is another topical option as an antifungal we have in some of our topical products. Now, that's daunting, right? I also like to bring this study up. So, as a dermatologist, I ask a lot of my clients, but I also have to recognize I can overwhelm them and I need priorities. So, this is a study that looked at complexity of the treatment plan and how it can really significantly contribute to caregiver burden. Caregiver burden is a term that's from the human field. When you are not the one who's necessarily ill or needs treatment, but you're taking care of someone who needs that. So you have a child who has a disease process that you have to bring them to appointments for, you have to go to the pharmacy for, you have to spend money for, you have to deal with their emotions for, you have to deal with your own emotions for. You have an elderly parent that you have to care for and bring. There is still a burden that comes upon you as the caregiver, even though you're not the one who's sick. And we have studies that actually show that this is also true for our clients who are dealing with their dogs that have issues that they have to manage and bring them to appointments, and they have to administer treatment. And essentially, the complexity of that treatment plan can contribute to that. It can affect the relationship with the veterinarian and the client. I give you 8 things to do. It sounds like a great plan, but it's so much that as the client, I can't do it and I'm just frustrated. So that's why you're seeing a lot of movement towards some of these other options where we can control some of that caregiver burden for the client. So let's jump back into terbinafine. So terbinafine, that particular antifungal, an alamine class. So again, it's not an azole, it's something different. It inhibits squalene epoxidation during sterol synthesis. And one of the products that has been around the last several years is Acernia, which has this medication in it. So now let's look at the traditional treatment limitations. So we are doing something like we're going to put stuff in the ear. What have we had the last 10, 20 years? So usually multiple daily dosing for the client. It increases the complexity of the plan, which means maybe they're not doing it as often. And remember, we talked about how that is one of the potentials to create resistance is the owners can't keep up with it. So we're underdosing, we're not treating it appropriately. The money associated with that, our busy schedules to do a once daily, twice daily thing in the ear canal, life distractions. Yeah, I meant to, but then my kids started yelling at me, right? I had a meeting I had to go to, and then I just totally forgot and haven't done the ear medications for 3 days. And then, as we talked about, antimicrobial stewardship. So, most commercial products have an antibiotic and an antifungal in them when we look at what we've had available for years. So how can we take a portion of that complexity away from what we've had in the past? This was actually a study done with Osurnia over in Europe. So this looked at the quality of life with dogs that had otitis externa in their owners. So they looked at the clinical and cytology parameters of Osurnia compared to treatments that the owners had to do at home. So of those 50 client-owned dogs, they were treated for 2 weeks. They either got a leave-in product like Osurnia and then repeated a dose a week after, or they gave daily medications at home. So all of the ear canals got better. But what they saw was there was a significant improvement of the quality of life for dogs and owners. So not just one or the other, both, if they did an in-clinic product, because they didn't have to get their dog and shove something in their ear canal and feel guilty, and they didn't have to remember and have the guilt when they forgot. So it allowed their quality of life to be better. So now if we look at, okay, I get it. If we do things, it can be easier for the owner. I get the different options we have for treating Malassezia otitis, but like how common is it really? So this is otic pathogen data from Osurnia, USA field studies, and this essentially looked at 333 otitis externa total cases, client-owned dogs, clinics across the US. And so the cytology or culture was done prior to they put anything in the ear like Osurnia. And you can see predominantly we actually saw Malassezia pachydermatous as the driving issue. Also staph, there were some ears that had both Malassezia and staph, and then of course you're going to have other things like gram-negative rods, but actually almost half of the cases were only Malassezia. So it is something that we see pretty commonly. I'm sure as a clinician you have lots of yeast otitis cases that you are managing. So based on everything we've talked to this point, we have to be really cautious and careful about what we're putting in the ears to treat these Malassezia otitis cases, making sure that we're being thoughtful of the future cases we're going to see and not causing more resistance by putting an antibiotic in the ear if we don't need it. And then again, prevalence of this. So it was so high, these ears don't need antibiotics. But in the past, we've been really limited to what we could put in the ears because most of the other products have also had an antibiotic present. So when we talk about, practicing really good antibiotic use, right, we don't want to use the systemic. There's limitations to creating things within our clinics or doing compounding pharmacies, but yet we're trying to be good antimicrobial stewards, but we're limited on what's commercially available that does not contain an antibiotic, and we don't want to treat them systemically. Until now. Until now, where we have more innovative solutions, where we actually can be thoughtful of how we are treating these Malassezia otitis ears, that we can be thoughtful about what we're putting in the ear canal, and we can be thoughtful about what we're asking the client to do and try to make their life a little bit easier. So step in, Duotic. Duotic is a product that has come out by Dechra that has terbinafine and betamethasone in it and not an antibiotic. So this is going to allow practicing antimicrobial stewardship much simpler, especially when you're talking about how prevalent it is for you to see an otitis case in your practice that's only Malassezia. So it is 2 pre-measured doses, 7 days apart. So very similar to Osurnia. You have the tube of ear ointment. You put it within, or sorry, gel. You put that gel within the ear. So we flush out the ear, put the gel into the ear. They come back a week later, and then we put another dose in the ear. We do not flush on that second dose. We just put another dose in the ear. So my technicians, my assistants are able to do that to make it a very quick exam for the owner. And so it's nice because I still can look into that ear real quick, make sure things are being effective. My technicians can still get a quick update from the owner. Hey, it's doing much better since you put that material in last week. So the nice thing too, it's got a very soft, flexible tip, easy to administer in the clinic. It's got a patented gel, very similar, that it coats and adheres to the entire ear canal for increased contact time. So it really just gives us the opportunity to make sure that we have an easy thing to put in the ear canal, that it coats that ear canal, that it's comfortable when we're applying it, right? Because as a veterinarian, if we're still applying it in that ear canal, then ultimately we don't want to be the bad guys as much as possible. So it just makes it a much simpler process for us, for the owner, and for the patient, which is wonderful. So I can say all these great things, right? And convince you like these new ear products are great because they are. But let's actually show you a case because when I got this product, I was excited, but I'm always questioning, right? But let's see if it actually works. Like, let's actually put it boots on the ground, put it into use and one of my patients and see how effective this is. So let me introduce you to Sadie. Sadie presents to me as a 7-year-old female spayed Labrador Retriever. She had a chronic history of pedal pruritus, so licking and chewing her paws, and recurrent otitis. And so I had actually seen Sadie for a while up to this point and did my best to manage her allergies. Her skin pruritus actually respond really well to immunotherapy, so we know she's atopic. We did put her on a diet trial, which did help as well. We've kind of got her atopic disease in her food allergy, right? She's a lab, so that's pretty common to have both fairly controlled. Her skin pruritus is doing really well on immunotherapy, and she also takes oclacitinib when she needs to. Her ear improved with a specialist diet, a hydrolyzed diet, but we just never can fully get it to respond. So there's probably some atopic portion of her disease that we can't fully get under control. So her skin's doing pretty well. We do the best we can with her ears, but she's still flaring more than I would really like. So her history has been the gamut, right? She's been on numerous topical ear medications and flushes between her primary vet, but even the things I had tried to do with her, we're doing our best, we're educating. This is a very wonderful owner, really committed to her. But Sadie's just had enough. Sadie's over it. We have done a lot with her for her chronic allergies, and she is just really sick. She's a very sweet girl, but she's very sick of having her ears messed with. So to the point where she's getting very resistant to ear therapy. The owners report anytime they go to reach for a flush or a topical, she's just dodging away. She runs away from them. They really have to coerce her out. It takes them a long time to actually do anything into her ears. And she's become that dreaded head shy, where even when she sees me, she's dodging away when she sees the swab. I have to coerce her with treats. I have to really encourage her, and we can do those things. But our concern is that she's just going to keep getting worse. As a 7-year-old dog, right? We still have years and years of managing her, so we want to make sure that we can have options. So at the time she presented to me, she had moderate head shaking and pawing at the ears. So she was still shaking her head. Her feet were pretty well controlled, her paws, as far as her itch goes, but she's still really, really scratching at her ears and really shaking her head. The owners were definitely at a point in their life that they were unable, they would try their best, but they were really unable to keep up with frequent ear flushes in the clinic due to the schedule. So sometimes we would try to have them come in once a week for us to do it, but that just became a bit unrealistic to do as our only solution. So here is Sadie. So this is probably a very common, typical ear discharge and cytology that you see in the clinic. So she comes in, we're always dealing with malassezia otitis, and we decide to try something different because Duotic had just come out. So first recheck was after Duotic is released for me here in the US. We do an in-clinic ear flush with a ketoconazole ear flush, just, that also had a pH change, acetic acid, boric acid in it. So we decided, hey, we're going to flush the ear out, get that debris out. You could see my otoscope had a bunch of discharge on it. And then we're going to use something that's anti-yeast anyway, since we're doing that. And then we're going to try Duotic. And so we flushed her ears out, we gave Duotic, and then she came back 1 week later. And the owner came back, brought Sadie in as a technician appointment. They always check in, do a quick check with me, the techs do. And then as we're going to repeat the dosing, the owner had told my technician she was already seeing improvement. She already could tell she was more comfortable because not only do we get the benefit of anti-yeast in the ear, remember there is a steroid in this product too. So just getting the steroid into that ear canal along with getting something anti-yeast into that ear canal can really help to provide relief, to provide comfort. So we rechecked her as an actual doctor recheck 4 weeks later, and we saw complete resolution of her yeast otitis, which was wonderful. And we've been able to just kind of reserve this. She's actually done quite well and had pretty long periods of time in between her malassezia otitis, more than we had seen previously, probably because we were able to very effectively treat it in clinic and not just rely on what the owner could do at home when she was really struggling. So when we talk about treatment options, let's be rational, not irrational. Gotta love the play on words, but we want to be rational, right? Like we want to make sure that we are just treating what needs to be treated. We want to make sure we're being thoughtful of not building more antibiotic resistance in our world that we're already seeing way too much of. We want to make things easier for the owner when we are able to. We want to preserve the relationship for that owner and their pet if we can. So, with that, we want to start by, of course, getting cytology, know what we are treating. It's important. And now that we have a commercial option, that if it's just yeast, we can treat just yeast and inflammation. We don't need to expose them to an antibiotic that's unnecessary when they're not dealing with a bacteria within their ear canal. Targeted topical therapy. We need to rely on topical therapies, whether it's a flush that we do in the clinic, the owner does at home, making sure that the targeted portion also includes only ingredients that we need. So now that we have a product like Duotic that is just yeast and a steroid, we can effectively treat them. We can target what we need to target. Improve client compliance. Again, having a product like Duotic that we can do in the clinic, we know if they've gotten it or not. We're not relying on, well, are they really telling the truth for how much they give? We're not relying on, maybe the owner's feeling really guilty that they haven't been able to keep up with it, so they don't tell us the truth. We preserve that relationship for us and the client, that we're not asking them to do too much at home that they can't keep up with. So by improving client compliance, we're also going to be happier as clinicians, but also, again, have happier clients that make them want to keep coming back. It's really nice that we can recheck that otitis progress, even if it's just a quick look in the ear, or an update from the owner, because they're there and my staff can ask, hey, have you seen improvement? So I think that is a really huge benefit. We have to be continually rechecking these cases, making sure they're responding, looking in the ear, making sure the swelling's going down, making sure their comfort is restoring, so we can make faster changes if that's not the case. And then ultimately, it's always, you'll never get out of an otitis lecture without the dermatologist mentioning, we need to figure out why it's happening. We need to identify the underlying cause. We need to make sure we know why the otitis is there. Yes, it is often due to atopic dermatitis or a food allergy, but it's not always due to that. So we need to be thinking of what questions we ask the owner, what do they look like during their dermatologic or physical exam? Are there other anatomical areas like erythema to the paws that really could give us the indication it's allergies? Or, is it a dog that all of a sudden is gaining weight and they're 8 and they're kind of lethargic and punky? Because I can see hypothyroidism, endocrinopathies lead to ear infections, ear masses lead to ear infections, foreign bodies lead to ear infections. So it's always crucial to make sure we really dig into that workup, that history, to know why the ear infection is happening in the first place. So let's be rational, not irrational. Cytology, so we actually know what we're treating. Target your topical therapy based on what your otoscopic exam shows and what your cytology shows. Improve client compliance when you can. When you have products like Duotic where we can administer it, we can take that away from the owner. We can make sure that, yes, if you got it, you got it, because we're the ones who did it, that we can be more effective in treating these ears. We have the ability in that week mark to recheck the progress with otitis, just make sure we are seeing resolution and improvement. And then, of course, after all of that or through all of that, we're figuring out why in the world the ear infection is there in the first place, so we can try to minimize that happens in the future as often. So what we talked about today, we broke down otitis, we made sure we know to cytology and to look in the ear, we talked about targeting our topical therapy, the products that are out that really give us options to not use more than we need. We talked about how important it is with that rise of the resistance. We're seeing more and more resistant bacteria still, which is scary. What do we do to stop or prevent that from happening more? Talked about fungal foes, Malassezia, how it can be very uncomfortable for our pets. It can be really disheartening for our owners. Then, of course, we talked about the innovative solutions in ear therapies. Having a product like Duotic that allows us to do something within the clinic so that we know what's happening, we improve compliance, we preserve that relationship, and that we can use something that doesn't have an antibiotic when we don't need it. We saw prevalence of Malassezia otitis alone is pretty high, 40% out of over 300 cases. So I really hope this really provided some knowledge, some excitement about the options that we do have. And with that, of course, I want to thank DECRA for putting innovative products out there, but also supporting really good quality CE for you guys. I think it's so important that we see companies doing that. I want to leave it open to any questions and just really thank you for your time listening in and hopefully getting excited about the options you have now to treat your Malassezia otitis cases.
Brilliant. Thank you so much for that, Ashley. We have, as I am sure you're not surprised, got lots and lots of questions coming in throughout that. So hopefully we can just dive straight in with, let's start with sort of your practical experiences, because obviously the product has been available in the US just for a little while longer than it has over here in Europe, and you've got practical experience of using it. So one of the questions we've had in is, do you see when you're using long-acting products like Acernia and Duotic that you get a build-up of debris because you're not cleaning that ear every day?
I think that is an amazing question because it's something that was a concern of mine, right? When some of these leave-in products came out, because I am a big advocate for ear flushing. And it always goes back to a bit of that annoying derm answer that I know everybody hates, but it's just true. And that is, it depends. And it really does. We are flushing pretty assertively before we put in a lot of the leave-in products to remove the debris. I think the wonderful thing about a lot of these products is because they have that kind of patented gel and it really coats the canal and they have steroids in them, we often get a reduction in inflammation, adherence to that epithelium. And then I don't see that I get a lot of that excessive debris. But there certainly are cases if I have a really bad biofilm ear that maybe I would make a different selection for that patient. So we do see some buildup of debris when we see them at that week mark. But to be honest, I haven't noticed it being excessive. And just the fact that my owners are able to take something off their plate and it's easier for them to treat, I don't usually foresee it being an issue as far as treating them, but that's why it's always nice to see them at that 1 week mark as well.
Brilliant. And another sort of on the same lines as a sort of practical questions, we've had a couple of questions in as to, now we've got this product, where would your sort of line be drawn, if you've got one, as to using a corticosteroid only product and a flush in comparison to something like Duotic that has got that anti-inflammatory and the antifungal component to it?
Yeah, there is a lot of consideration when I'm picking a product that I consider, because I know everybody really wants, well, if it's 2+ yeast, do this. You know, if it's 1+ yeast, do this. And again, it's always hard because there's so many factors. A lot of cases that I see, and I totally understand as a specialist, I probably see the more difficult cases on a day-to-day basis, but I know you guys are seeing a lot of yeast otitis too. If I have that patient coming in and they have any sort of yeast abundance, whether it's 1+, 2+, whatever kind of category works for you as far as evaluating the amount there, and they're super symptomatic, that's what's important to me, is how symptomatic is the patient? Did I just look in the ear? The owner says they're not bothering their ear at all. And I just see, oh, there's some brown debris. I check and there's a little bit of yeast there. If they're not that bothered by it, I may take a more mild inflammatory approach and not expose them to an anti-yeast medication. But usually what happens is I get the cases that come in, they're head shaking everywhere, they're pawing at their ears, they're uncomfortable. Owners will say they're really head shy when they go towards them because they're having an ear infection. That's usually why they're presenting to me. Then I do think, even if it is a smaller amount of yeast, if I can treat it topically, if I can treat it easily for the owner, then I'm going to use a product that actually has the anti-yeast in it. I also deal with a lot of what we call yeast hypersensitive dogs. Any overgrowth of yeast causes them to have a dramatic amount of pruritus. So I take all of those things in consideration, but I'd say yes, quantity of knowing what's there is important, but I would also really advocate that knowing how symptomatic that patient is also equally as important when you're deciding how to treat them.
Brilliant, thank you. We've had a couple of questions on what you would do in those atopic patients in between flares of otitis externa. Do you have, I mean, we don't have anything licensed in that sort of space, so do you have any sort of protocols or advice for what could be deemed as sort of maintenance of these patients?
Yeah, I mean, I think that's where ear flushing is huge, right? So I think a lot of times we really focus on ear flushes just being used for active infections. But ear flushing, and depending on what you're maintaining, if they are a dog that just chronically has yeast otitis and you're doing the best you can in between the flares, I'm probably using something that has some anti-yeast properties to it as maintenance. That doesn't have to be a particular antifungal medication in the flush. That can just be something that changes the pH, like I mentioned in the lecture. So maybe those are the cases that I would keep on weekly acetic acid, boric acid flushing just to maintain the pH of that ear as a maintenance step for them. And then maybe we are reserving something like duotic for when inevitably we know spring is going to come. It's going to probably cause a yeast otitis that flushing can't handle on its own, and then we're going to utilize that. I use a lot of what we call ceruminolytics for maintenance flushing. So just products that don't necessarily have anything to do with infection, but in the name ceruminolytic, they help to break down that cerumen, which is earwax, just the medical term for earwax. And so by kind of having some sort of maintenance protocol, like weekly flushing with the ceruminolytic, every other week flushing, if that's what works for them, depending on their pet, if just removing that debris, and some of these products also have more kind of soothing properties to them, that also can be really, really helpful for these dogs who just need some sort of maintenance. Depending on what country you're in, some of us have certain topical steroids that you can put in the ears, and those can be helpful. But honestly, maintenance ear flushing, I think, is really, really beneficial in these cases.
I agree. We've had a couple, again, on a very practical sort of level, we've had a couple of questions in about those cases where you know the tympanic membrane's ruptured, or in more practical cases, you can't visualize the tympanic membrane. Now, we have no licensed products in that space, full stop. Just for clarification, duotic, Osurnia, in fact, any of Dechra's licensed topical ear medications are not licensed to be used where there's a ruptured tympanic membrane. So that leaves us with a bit of a dilemma as practicing vets as to what we do in that situation. And certainly we're seeing that in the questions. Can you tell us what your personal approach would be?
Definitely, and it's always a hard question. I'd say it's one of the most common questions about otitis, right? And I'm in the clinic with you guys. It's like I'm in the clinic, it's busy. I see a ton of otitis, and that is always the difficult part. Just like you mentioned, it's same here in the United States where I practice. There is no commercial product that's just completely free giving of, oh, there's a ruptured tympanum, this is completely safe to give. No commercial product has that. And sometimes even when we've looked at the products that are compounded, they don't have a label for it either, right? I mean, they're just things that we kind of all learn, or we work through pharmacies to create in some situations. So then what do you do? So, that's a discussion I have with the owners regarding on-label use of a medication. That's also where I do advocate for it. Like you mentioned, I'd say the most common situation is I'm not sure if there's an eardrum or not because there's a bunch of gunk in the ear that's present. So that's where I will really try to advocate for a really good deep thorough flush. So one, I can get the stuff out of there, but two, I can try to visualize the tympanic membrane. There's never a guarantee of an eardrum being completely intact. Even when it looks really intact to us, you can still have micro tears that are in the eardrum. Those can happen. I always also really teach that you can tell me an eardrum appears intact the moment you look at it. You can't tell me that you don't bring the dog back to the owner, they shake their head and they just ruptured it in those 5 minutes they went back, right? I mean, those are challenges we all face. Is I will say apparently appears intact, but we don't really know for sure. Now, the flip side to that is infections are also ototoxic. So it is really, really tough. But if we also don't address the infection that's present, especially when you get into some of these really scary things we talked about, these resistant bacteria, and yeast can still be a problem, right? Then that's going to also be ototoxic and cause a lot of issues to the ear. So it is really tough. I mean, really the only things that we can say for certainty are probably okay, is like sterile saline, right? We really are kind of in a hard place with that. But I really try to flush to get a better idea of what it looks like. And then if I do need to treat them with something that maybe is off label, we have a discussion of watching for things like ototoxicity, which is still usually quite rare. But if we don't treat the infection, that's inevitably also going to cause ototoxicity. So it is a very delicate line that we have to walk with that.
Agreed. It's one of the perils of practice, as we sometimes like to say, isn't it? But thank you for that. That's really insightful. I think we've got a couple of DECRA-based questions in terms of use of the product in cats. It's not licensed for use in cats. There are very similar warnings on the label as you would see with a Cernia in that instance, certainly for those of us based in Europe. So from a DECRA standpoint, we wouldn't recommend use in cats, but I've had that question a couple of times, so I just wanted to address that. Another practical question, which might be a little bit frustrating, and I do apologise to the audience, but there has been a number of questions as to which flushes you use that have got a antifungal component in them. Now, my understanding is that they are ones that are only available in the US, unfortunately, or whether you could get them into your countries, it will really, really vary. But you do have flushes in the US which are marketed, which do have antifungals in them, right, Ashley?
Yeah, and I know that's always the tough part when I speak in other countries. Sometimes I'm jealous of like some of the things that certain countries have and we don't have. And then sometimes it's flip-flop. So again, just look at the ingredients. I think sometimes we get really stuck on just like a name, like a brand of it, but like look at ingredients, kind of know that just removing debris, even a sperminolytic, can be really helpful if you're using something like Duotic, if you don't have one of those products available to you.
We've had a question, again, these are really good practical based questions. You touched on sort of malassezia hypersensitivity or malassezia allergy in your cases. Do you do anything more specific or have any recommendations for managing those cases where, you know, you look down your cytology, there's maybe 1 or 2 malassezia organisms, but that ear is harsh, you know, that dog is suffering. So would you treat those any differently than a bog standard yeast otitis case?
Yeah, sometimes malassezia hypersensitivity, I think, is something that's really, really frustrating, but to many of us in the clinical aspect as dermatologists, many of us think is truly, truly real. And that is when no matter it seems like what you do, any sort of little yeast outbreak they have, they just dramatically get itchy, to the point that when we do like intradermal allergy testing for environmental allergies, we actually test them for malassezia, and then they have a history of really struggling with malassezia and they're positive on their intradermal test, we'll even try to desensitize them. So I would say that is one aspect, is that if they really struggle with yeast, we can actually include it within their immunotherapy if they do that, just to try to see if we can desensitize them, just like we would with any pollen, dander that we're trying to desensitize to. I do think inflammation control becomes really, really important in these cases. You know, if you just have a mild amount of yeast overgrowth, you know, maybe we treat it topically, but maybe we definitely need to really reconsider like our allergic symptomatic control. Like, is this a situation where they might benefit from a couple weeks of steroids? I mean, that's the nice thing about these products like Duotic, is it's not just a yeast, right? There's a steroid in it too. And so that helps to provide a lot of relief when they are really triggered by these things. In really severe cases where no matter what we do to manage their allergies, and I always tell owners they have to prove this to me because I don't necessarily like to do it, but I work in a really moist environment and I see the worst cases. Some of these cases that really struggle with yeast all over, we'll even have protocols where we have to use frequent topicals on them to control it. Or at least in the US, where I know that we're unfortunately a little bit more available to our antimicrobials, which we probably shouldn't be because we have one of the highest resistant rates, to be honest, is sometimes we will have to lean on something called pulse therapy, where we have to give them something like an antifungal a few times a week as a protocol. But that to me is like last resort. I really try to control their allergies primarily first, use topicals the best that I can. And then just know that that is a really real thing. And if I can get them to allergy tests, I really try to desensitize them so we do not become so dependent on the antifungals.
We actually had a question in about pulse therapy as an ongoing treatment for yeast otitis. So hopefully that will have addressed that question too. So you're one step ahead even in the question.
Love when I accidentally answer questions. Great.
It's great. I think we look like we've covered quite a lot here. Oh, I think another interesting question actually here. Somebody's asked what you would do if you are treating according to a cytology and it's not going the way that you planned, i.e., do you ever feel like you've got your cytology wrong? As is the way the question is posed. I hope I'm interpreting that in the right way. So do whoever asked that in the audience, if I'm not, please type in again. But yeah, what about those cases where you treat what you think you're seeing, but you're not getting the response that you would anticipate?
Yeah, repeat cytology for sure. That happens. That happens to me with skin and ears too. Again, we're dealing usually with chronic issues like allergies that's causing the infection. So let's say that I check my ear, it's just yeast. I do something like duotic. Maybe they initially seem to get better. I put in the second dose at the week mark, but then the owner calls a couple weeks later saying, man, it seemed to be better. Now it's like worse. I've certainly had cases that, they were yeast and then all of a sudden some bacteria pops up, whether I did miss a little small population on my cytology, right? We're not getting the entire ear on cytology. We're just getting some sort of representation. Of course, we see resistant infections where I was rods, I thought I treated appropriately, they're not getting better, I recheck, it's still rods. I mean, certainly you can still have failure of topical therapy, whether it is they're not doing it appropriately, if you're doing something at home, or if you just have a resistant infection to that topical. I mean, certainly that can still exist, but repeating it can be really important. I mean, I know we're talking about ears today, but for skin example, I have many, I'd say daily cases that I repeat cytology or get numerous spots on them because I think, man, you look like a yeast factory and all I can find is cocci, and I just want to make sure that I'm not missing something. So I repeat cytology. I don't charge the owner like extra to repeat it within that same exam, but I will often repeat it, or I get an ear cytology and I'm like, man, really? There's nothing under the microscope? Like, I really feel like there should be, and I'll repeat it. And sometimes it is just a bunch of ceruminous debris in that ear and they're itchy from that, but sometimes you just get a different spot and then you do get another sample that guides you in the right direction. So I would say do not be afraid to repeat cytology for sure. It's not a standardized thing, right? We're all just grabbing them quickly while we're seeing the case. So we do have to recognize some of the limitations and not be afraid to repeat it so that we can feel like we're best serving that patient.
Agree. I mean, it's a dynamic thing. Things can change. It completely agree with you there. Just a few more very practical roundup questions that we've had from people. Is this going to be available afterwards because they want to share it within their clinic, which is music to my ears? Yes, absolutely. This recording will be available on the DECRA Academy for you. So please do, if you think this is something that your colleagues would benefit from, or you want to catch up on something again in the future, that's going to be available there for you. And finally, I think the last thing to do is just to say a really massive thank you, Dr. Bourgeois. I mean, the level of questioning you can see, the engagement that we've had has been fantastic this evening. So I think that it's been thumbs up all round. I apologise to everyone out there if you can't see our cameras. I can see Dr. Bourgeois and Dr. Bourgeois can see me, but apparently you guys out there may not be able to see us. So hopefully our voices
are just
for
singing
everyone.
music for you.
I know. We're just prepping for the podcast, Ashley. It's just it's helping people get into that frame of mind.
Podcast is what I usually do anyway, so hopefully they're used to it. No, I really appreciate it. And it's always really nice to have engaged audiences and actually get questions. So I really appreciate the attention.
Yeah, brilliant. So have a good evening, everyone. Thanks for staying on board, and take care out there. Thank you.
Bye.
Bye-bye.